Cluster B personality disorders or group of mental health disorders. Look at this picture shows that personality disorders and support to overcome a detail going on. Introduction. Cluster B personality disorders are a group of mental health disorders characterized by traumatic, overly emotional, or unpredictable thinking and behaviors. These disorders often lead to significant interpersonal difficulties and impair functioning. People with these disorders frequently struggle with emotional regulation, impulsivity, and maintaining stable relationships. Cluster B is one of the three clusters in the DSM 5 classification of personality disorders. The others being cluster A, odd or eccentric disorders, and cluster C, anxious or fearful disorders. Definition. Cluster B personality disorders are defined by a category of personality disorder marked by behaviors that are dramatic, emotional, erratic, and attention seeking. These are chronic and pervasive, typically begin by early adulthood. Etymology. The term personality originates from the Latin word persona, meaning a theatrical mask or character, later evolving to signify an individual's distinctive character. Disorder comes from the old French disorder, meaning confusion or disruption, reflecting a deviation from typical psychological functioning. Epidemiology. Cluster B personality disorders are estimated to affect approximately 1.5 percentage to 6 percentage of the general population, with borderline personality disorder being the most commonly diagnosed. These disorders are more frequently identified in clinical setting than in the general population, often due to associated crises such as self-harm, aggression, or interpersonal conflicts. Types 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 of cluster B personality disorders. There are four types. 1. Antisocial personality disorder, ASPD, disranged for the rights of others. Deceitfulness, impulsivity, and lack of remorse. 2. Borderline personality disorder, BPD, intense fear of abandonment, unstable relationship, identity disturbances, emotional dysregulation, impulsivity. 3. Histrionic personality disorder HBD, excessive emotionality and attention seeking behavior, suggestibility and discomfort when not the center of attention. 4. Narcissistic personality disorder NPD, curiosity, need for admiration and lack of empathy for others. Causes. Cluster B personality disorders may have multifactorial origins, including 1. Genetic predisposition, family history of mental illness. 2. Neurobiological abnormalities. 3. Childhood trauma, abuse, neglect, abandonment. 4. Insecure or disorganized attachment styles. 5. Dysfunctional family dynamics. Risk factors. 1. Family history of personality disorders or mental illness. 2. Childhood abuse or neglect. 3. Unstable or chaotic upbringing. 4. Loss of parent or caregiver. 5. Substance abuse. 6. Low socioeconomic status. 7. Poor pure relationships. Complications. 1. Chronic interpersonal problems. 2. Legal issues, especially with ASPD. 3. Substance abuse. 4. Depression and anxiety. 5. Self-harming behaviors or suicide, especially in BPD. 6. Occupational and social dysfunction. 7. Comorbid psychiatric disorders. Pathophysiology. Pathophysiology of cluster B personality disorder step by step process. 1. Genetic vulnerability. Individuals may inherit genes associated with impulsivity, emotional dysregulation, or aggression, increasing their susceptibility to personality disorders. 2. Early environmental stresses. Adverse childhood experiences such as neglect, trauma, abuse, or inconsistent parenting disrupt normal emotional and social development. 2. Neurodevelopmental changes. These early experiences interfere with the development of brain regions involved in emotion regulation and impulse control, particularly the amygdala, hippocampus, and prefrontal cortex. 4. Neurotransmitter dysregulation. Imbalances in serotonin, dopamine, and norepinephrine contribute to mood instability, impulsivity, aggression, and poor stress responses. 5. Dysfunctional attachment formation. Poor caregiver relationship leads to maladaptive attachment styles, example, insecure, disorganized, affecting how individuals perceive and relate to others. 6. Maladaptive coping mechanisms due to emotional and social deficits. Individuals develop rigid self defeating behavior patterns. Example, manipulation, attention seeking, or withdrawal. 7. Cognitive and emotional dysregulation. Distorted thinking, example, black and white thinking, paranoia, and unstable emotions lead to identity disturbances, interpersonal chaos, and impulsive actions. 8. Chronic dysfunction. These patterns become ingrained, persist into adulthood, and lead to the chronic symptoms observed in cluster B personality disorders. Example, unstable relationships, aggression, self-harm. This process highlights the interaction between biology, early life experiences, and psychological development in shaping cluster B personality disorders. Signs and symptoms. 1. Antisocial personality disorder, violation of others' rights, criminal behavior, deceitfulness and manipulation, lack of guilt or remorse. 2. Borderline personality disorder, emotional instability, fear of abandonment, impulsive behaviors, example, substance use, binge eating, suicidal ideation, self injury, identity disturbance. 3. Histrionic personality disorder, attention seeking, excessive emotionality, inappropriate seductive behavior, especially influenced by others. 4. Narcotic personality disorder, grandiosity, preoccupation with fantasies of successes or power, need for admiration, exploitative behavior, lack of empathy. Diagnosis. Diagnosis is clinical and based on DSM-5 criteria includes 1. Clinical interview exploring life history, behaviors and symptoms. 2. Mental status examination. 3. Psychological tests MMP1 2 Milone clinical multi-axle inventory MCMI. 4. Rule out other medical or psychiatric conditions. Nursing diagnosis. 1. Risk for self mutilation BPD. 2. Impair social interaction. 3. Ineffective coping. 4. Risk for violence directed at others. 5. Disturbed personal identity. 6. Chronic low self-esteem. Medical management. Pharmacotherapy, though not curative. 1. Mood stabilizers, example lithium valproate for BPD. 2. Antidepressants, SSRIs for mood symptoms. 3. Antipsychotics for severe impulsivity or aggression. 4. Anxiolytics, curiously used for anxiety. Nursing management. 1. Establish a therapeutic nurse-patient relationship. 2. Set clear and consistent boundaries. 3. Use non-judgmental communication. 4. Monitor for suicidal or violent behavior. 5. Educate on coping strategies. 6. Encourage participation in therapy. 7. Manage manipulative behaviors with structure. Treatment options. 1. Psychotherapy. First line. Dialectical behavior therapy DBT. Especially effective for BPD. Cognitive behavioral therapy CBT. Mentalization based therapy MPT. Transference focused psychotherapy TFB. Schema therapy, group therapy, including 3. Family therapy. 4. Pharmacotherapy as maintained above. 5. Hospitalization if there is a danger to self or others. Psychosocial medicine. 1. A dialectical behavioral therapy DBT combines mindfulness, distress, tolerance, emotional regulation, and interpersonal effectiveness. 2. Cognitive behavioral therapy CBT help to identify and modify dysfunctional thoughts and behaviors. 3. Family education and support programs improves family dynamics and understanding of the disorder. 4. Psychoeducation increases awareness about the disorder, reduces stigma, and improves self-management. 5. Supportive psychotherapy and social skill training focus on building trust, social communication, and healthy coping mechanisms. Prevention. While primary prevention is difficult, early intervention can be effective. 1. Early identification of behavioral and emotional issues. 2. Preventive counseling for at-risk youth. 3. parenting program to improve attachment, 4. Trauma informed care in childhood, 5. Early treatment of anxiety or mood disorders, 6. Promoting emotional literacy and resilience. In conclusion, Cluster B personality disorders are complex, deeply rooted conditions affecting emotions, relationships, and behavior. Early diagnosis and consistent, structured, and compassionate care are crucial for management. Although these disorders are challenging, with the right therapeutic approach, individuals can experience significant improvement in functioning and quality of life. Nurses are play a pivotal role in improving support, establishing therapeutic alliances, and facilitating psychosocial interventions. Thank you. Have a nice day.